boys. Our dog is a boy, my poor wife. And they're boys. They, you know, play football, basketball, and that type of thing. And they just get they get so embarrassed sometimes. If they were here, they'd be mortified if I knew I was here, something like this. I have all these books at home on women's hormones, and I have about 10 of them lying around. I'm sitting at night, what you reading, Dad? Oh, it's a book on women's hormones. I go, oh, brother. It's just so funny. They get a kick out of it. But I was just thinking, because here it's Robert and I sit at a lot of these together. It's just us two. But anyways, I just wanted to talk real briefly about, well, you know, this term bioidentical, you know, what does that mean and how does that compare to the other stuff, and what's all this negative press we hear about, you know, hormones causing cancer and you should stay away from them and they're really not good for you. And so I just want to address that briefly. Bioidentical, I like to use the term human identical, really, when it comes to these hormones, because what that means is what Joanne deals with and what I make over at my pharmacy for her and her patients are bioidentical hormones, or human identical. If we took the progesterone or the estrogen or the testosterone out of your body, compared it to what's in the products that we make, it'd be the exact same thing, okay? It's derived from either a soy or a yam based. It's altered in a lab, then to be the exact same thing that's in your body, okay? So it's human identical, okay? That's not the same thing as the term natural, okay? Premarin is natural, okay? And I'm sure you're familiar with Premarin. You know, for those of you who don't know, the name comes from pregnant mare urine, of course. That's where the name comes from, because the estrogen, Premarin, that's the estrogen, comes from horse's urine, okay? Hard to believe. And I actually seen some pictures of how they have to collect that urine sometimes. It's not great for the animals either. And when it comes to that particular, it's called conjugated estrogen, okay? And it has about 100 different molecules of estrogen, and only one is similar to human estrogen, okay? So this is horse's estrogen, okay? It's just not what you need or should be putting in our bodies. It's very potent and works great for hot flashes. It works great. It'll take care of your hot flashes, but that's really about the only benefit to it, okay? All the negative press that you hear in many of the studies showing estrogen causing cancer are going to be studies that have synthetic estrogens. Not only estrogen, but not only Premarin, there are some other ones out there too, but Premarin is by far the one that's been used most throughout the years. Now when Premarin first came out too, one of the side effects, well, it's actually I shouldn't say a natural side effect, but it is a natural thing that estrogen does, is it does promote growth of the endometrial lining, okay? So when Premarin first came out, they noticed that a lot of women were developing an endometrial cancer. And so what they did to take care of that is give you another synthetic hormone called Provera. That was the brand name for medroxyprogesterone acetate, okay? And that is actually a progestin, okay? A progestin. Now, you have to be careful because there's even practitioners, many doctors who feel who think progestin, a synthetic progesterone, is the same as bioidentical progesterone. It is not, okay? It is very different. The only similarity that the progestin has to the natural progesterone is providing protection from estrogen's effects on the endometrial lining. That's really the only similarity between the two. Back there on the table, I have a handout that compares the two, okay? And it lists like the lipid profile, the liver function, cardiovascular, glucose, sleep, mood, bone, quality of life, all negatively affected by Provera or the progestin, all positively affected by natural progesterone, okay? So there is a big difference. And so when you read these things or hear these things, you need to poke a little bit deeper and find out what it's all about. When it comes to, you know, the big study that you've of course heard about is probably the WHI, or Women's Health Initiative, the particular study that had to be shut down early because they were finding an increased risk of stroke, breast cancer and cardiovascular disease. And that was in particularly with a product called Prempro, which is a combination in one pill of the Premarin and the Provera, okay? That particular arm of the study, they had to shut down early because of the increased risk in all of those factors, okay? And that's the one that doctors refer to, or that you hear in the press quite often when they speak negatively of hormone replacement. So again, you need to be sure to look at what they're talking about when you hear about these negative studies. Now I'm just talking about, briefly I'm going to talk about estrogen, progesterone, testosterone. Please remember that there are other hormones that are involved with this, and that they all sort of affect each other, and so it's important to pay attention to all of them. And I'm talking about cortisol, DHEA, thyroid, and of course insulin, okay? And these are things that Joanne is going to monitor, all of those things, because they all seem to affect each other, okay? But I'm just going to focus a little briefly here on the sex hormones, okay? In regards to estrogen, in women basically have three forms of estrogen, okay? They have estradiol, estriol, and estrone. Those are the three main estrogens. You'll hear them referred to as E3, E2, and E1. It's E3 is estriol, E2 is estradiol, and E1 is estrone. And a lot of this information, if you feel you can't get it down, there's a booklet we're going to have you take on the way home that has this all in there, so they'll review all this too. Okay. Now, when it comes to the compounded medications, well, first of all, let me address what's available commercially. There are some things that are bioidentical or human identical that are available commercially. And these are patches, topical estrogen. You might have heard of Ivell or Climera are the two most popular ones. And there's also oral estrogen. There is estradiol that is available orally. Now, there is a little bit of debate out there in regards to estrogen in terms of the safety of oral versus topical. Generally, the topical is going to be safer because oral estrogen tends to increase carcinogenic metabolites and also blood clotting factors. So there is an increased risk there. Now, oral estrogen, bioidentical estrogen, still generally is going to be safer, but why don't we do what's the most safe and stick with topical? So the commercially available products are generally the patches in those pills. The issue with that is that those are only one form of estrogen, the estradiol, okay? And that can work just fine. A lot of times your body can make the other estrogens that you need. But some women are going to need a combination product, or they're going to need a different strength that's not available in those commercially available products. And that's where we come in. We make all sorts of creams, topical creams, that either are a biased, which is just a combination of the two of the estrogens. We used to do what's called a lot of triestrogen. That involved all three. However, we found out that of those three estrogens, the estrone, that particular estrogen, has been found to be the most carcinogenic. And so generally we don't have, I still have some women on it, but not very many anymore, because they're finding out that most women can make the estrone that they need from their other estrogens. And so most of the creams we do are going to be a biestrogen that have the estriol and the estradiol, or just estradiol. And the great thing about compounding is we can make that in a strength that's going to fit you, and particularly based upon the testing that Joanne's going to do in her office. Okay? So we do all sorts of creams. We also do some capsules. We can do troches. We can do melt-in-the-mouth rapid dissolve tablets. And we do a lot of vaginal creams. Estriol is the safest estrogen there is, and that works particularly well in vaginal products, in vaginal creams, vaginal suppositories, for the vaginal dryness and the mucosal atrophy or the thinning of the lining, and it is a very safe estrogen. Many of the practitioners who are involved with this would, for anybody, even somebody who has a breast-sensitive cancer, feel safe using estriol vaginally to treat those symptoms. There are many studies that show that estriol itself may even be cancer protective. Okay, so estriol is a great estrogen, especially to treat those vaginal symptoms. When it comes to the progesterone, Progesterone has so many benefits. People come into the pharmacy, and for those of you, I recognize a few of you have come in, and when I first counsel people, I tell them it's my favorite thing in the whole pharmacy. I think it should be in the water. And I really do believe that. You know, what happens is, this is the other thing I always do too, as we age, I say to them, our estrogen goes like this. I have to catch myself because I know I'm not a female. What happens is, and this is going to be tough with a microphone, your estrogen sort of declines sort of slowly because you have other ways. Once your ovaries start to shut down, your adrenal glands can take over, and also fat tissue produces estrogen. But what happens is your progesterone levels really start to go down very quickly. And so, and that starts even as young as 35, even earlier, 30 years old maybe. And so a lot of times all we need to do is to take care of some of these symptoms that many doctors who aren't trained in this feel you may need estrogen to take care of. A lot of times just supplementing with progesterone will take care of these hot flashes, will take care of this moodiness, will take care of the irritability or the difficulty sleeping. And the wonderful thing about progesterone is it's really never been shown in any study to cause cancer. It's only been shown in many studies to be protective against breast and uterine cancer. And the benefits go on and on and on with progesterone. It's a natural diuretic, it helps with sleep, it's an anxiolytic, it helps with osteoporosis, and it just goes on and on. So progesterone is really my favorite thing. There's really not a downside to it. If we get too much, we feel a little lethargic, we might get a little depressed, we just cut back on the dose, and we're going to be just fine. So progesterone is just it's just a wonderful, wonderful thing. In terms of products that are available, commercially there are a couple of things. There's a Prometrium pill capsule, only comes in 2 different strengths though, and it is in a peanut oil, so if you have a peanut allergy, we have to avoid that. There is one progesterone gel, vaginal gel too. Don't see that prescribed hardly at all. But those are really the only options commercially of a bioidentical progesterone. So we compound a lot of progesterone in all sort of different strengths. And let me get back to when it comes to taking progesterone orally, that's fine. Estrogen and testosterone, we really don't want to do that because I mentioned the things with estrogen, but with testosterone, I'll talk about that briefly too. That's very hard in the liver. But progesterone, it's not so much the case. It's very safe to take orally. We can also do it topically though. Some practitioners believe the benefit of topically may be a little more steady levels throughout the body, as to orally may give you a little more up and down. But that's debatable. Some women just do better on one form than another. And that's the great thing about compounding, is we can make what's going to do best for you, okay? And that's what's a really cool thing, and that's what I really enjoy. So not only creams and capsules, we can also do the rapid dissolve tablets, a sublingual solution that you put under your tongue, a lot of neat options for progesterone. And then finally, testosterone. You know, everything you hear about testosterone, well, I don't want that. I don't want to increase my libido. I'm not interested in that, okay? Well, there's a lot of other benefits to testosterone, okay? That's probably the least important of all, but it does work very well for that, okay? It is great for osteoporosis. That is the neat thing about estrogen, progesterone, and testosterone. Each one is beneficial to your bone in a different way. One helps prevent the breakdown, one promotes the growth, and one makes better, stronger bone, okay? And so the 3 of those together are just terrific. So much better than these, what are called biphosphonates or Fosamax, you probably heard is the most popular one. The problem with those is what they're finding out is that those things are forming a very brittle kind of bone, not a very good bone, not a very strong and healthy bone. And so if any of you are on those, especially more than 5 years, you really want to think about maybe getting off of that. Up to 5 years use is probably the limit on that. But anyways, besides that, testosterone helps with overall energy, it helps build muscle mass, helps you break down fat. It's just very, very beneficial if it's done in the right way. Now, there's not a lot commercially available. The fact there's nothing bioidentical commercially available in testosterone. There's one product called Estrotest, which combines a synthetic estrogen and a synthetic testosterone, which is just awful, I think. You really should avoid that. So we compound a lot of testosterone creams. And that's probably the thing we do more than any form is the creams, but we also can do, again, the sublingual rapid dissolve tablets and troches, things that you suck on. And again, we can do these in all strengths. That is going to be particular to you, that you're going to need based on the testing that Joanne is going to do. I can go on and on and on here. A lot of this information is going to be in this booklet that we have for you to take on your way out if you haven't got one already. And please feel free to call me at the pharmacy if you have any questions. I really enjoy talking about this stuff. So, thank you. Are there any questions on what I've talked about? And I'll be available to attend to. Yes?
You mentioned, I guess, that estrogen being made from yams and some other vegetables. What about the progesterone and the testosterone? Are those made from animal products? Or?
You know, those are also going to be soy or yam based, and either one. And then, but it really doesn't even matter what the base is, but that's what it is. And the particular products that we make, we only order our particular hormones from one company. We've been doing that for 19 years. They're a little more expensive, but everything they get into their facility, they test for purity and potency before they send it out to us. I have access. You can ask me anytime. I'd like to see the certificate of analysis of what you used in the product I make. I can go get it to you and print that off for you, okay? But it is soy or yam based, but it is altered in a lab. Now people say, whoa, whoa, altered in a lab, synthetic. Well, it's altered in a lab to be the exact same thing that is in your body. You cannot look, the chemical structure is exactly the same. Now there's debate, like say if someone has a soy allergy, will it be an issue? I've never seen it. But then we can always do a yam based just in case there's a concern, but I've never seen it.
I just wanted to briefly talk about how do we test levels of these hormones, because we had a few people that wanted to talk about weight and how difficult it is to really function to keep that weight under control when we're menopausal. But going back to what Gordon said was we don't have to worry so much about replacing estrogen because estrogen is made in the fat cells. Our adrenal glands, which sit on the kidneys, help to make the estrogens, but the fat cells are estrogen factories. And so that's why when our bodies don't have enough progesterone in them, then we don't balance that estrogen, and the estrogen's dominant. When estrogen is dominant, then you have a fat magnet. The body just keeps producing more estrogen, the estrogen stores as fat, and you can't lose it. And so what we have to do is we have to do some testing. I have a few kits up here. Now, saliva testing is really good to do as a baseline when you're menopausal. Don't try to get a saliva test when you're still having periods. It's ridiculous. You'll never get a level that's consistent. It's going to be different next month and the next month after that. But this is a great baseline tool to do at home to detect your hormone levels baseline. And then there's also a urine test. And I want to talk about this as the most important test to do when you are menopausal and you've taken a hormone test, a saliva test. Do the urine test. What the urine test tells us is how does your body excrete the hormone when you're done using it. How many times have you seen people go on hormone replacement and they say, I've gained 10 pounds, I'm not staying on this stuff, it's just making me fat. But when the body's done using it, the liver has to detoxify it. But there's two phases of detox. If we don't have enough antioxidants in plant-based food in our diet, we can't hydroxylate, which is phase 1 of the detox from the liver. So we will store estrogens and keep recycling them if our diet is not rich in plants. Another plug for whole food nutrition. Number 2 is we have to be able to methylate. And I had not known this term, but it is so important now that I've learned more about it. If we cannot methylate, then our liver cannot excrete that residual hormone out into the colon to get rid of it. And what it does is it recirculates the excess hormone. Methylation is helped in the body by using things like plant cruciferous vegetables, methionine. One of the simplest ways to add methionine to the diet is by taking something called SAMe. How many people know what SAMe is? On the box it says, naturally restores a healthy mood. Well, if you had your excess estrogen going down the tubes like it's supposed to, would you not have a better mood? Estrogen makes us grumpy, it makes us edgy, it makes us irritable, it makes us gain weight and bloat and headaches and sleeplessness and hot flashes. It's not a lack of estrogen, it's too much. So the SAMe helps us excrete the excess estrogen out of the body. That is so important. There's other things that have methionine in them. MSM, you hear of glucosamine, chondroitin, and MSM? MSM is a methyl donor. It's got methionine, it's a methyl donor. So we need to be ingesting these things. And there's also things like indole 3-carbinol or DIM. Okay, these are things that we can learn about that will help assist the excretion of the hormones. So it's not just okay to go buy the over-the-counter stuff and start lathering it all over and expect our bodies to have hormone balance, because there's so much that goes into it. But I will say one thing about the excess estrogen. Our fat needs to go away. It's important to get it to go away. So if you're not able to get it to go away and everything that you know how to get it to go away, talk to me, because I have learned about a very quick, fast weight loss program that's safe to do because I supervise it. It's called the Ideal Protein Diet. There are brochures up here, and trust me when I tell you it works so fast you can't be on it longer than a couple of months, because none of you have enough weight to lose, more than a couple of months. But it peels the weight off of you, but what it does is it makes you get rid of your fat naturally. No injections, no speed, no Phentermine, nothing. So that's something that I really highly recommend that you look into. If you're struggling with that 20 pounds that you just can't shake, you've done everything, you've worked directly with me, talk to me about it, because it's something that you could use. I would welcome you at the end here to come up and just peruse the table. Take a postcard. We have the postcards with the price of the thermography. This will let us know that you attended the seminar, so when you make your appointment to come in, you can take the time to share with your friends about what you learned here tonight, because it's so, so important. It can save lives. Don't let them wait 3 years to get a mammogram because they're worried about the money. I can't afford to get a mammogram. My insurance only pays every 3 years. Thermography is safe, it's affordable, it's doable. You can do it as many times as you need to. Don't be afraid of it. It's local, it's right here, we have it in our office. So now you've heard how to prevent, how to detect, and how to use safe hormones. I'm hoping that you can feel a little bit more comfortable with any of the prescriptions that you may have already been prescribed that you're taking, but that you might have learned a few things that you need yet to add to your nutrition piece. If your vitamin D is not intact and you haven't get it checked, get it checked. Vitamin B12 is another vitamin. You have a list of things on the paper that you have in front of you. Visit it. Really get responsible for your own health, and then ask the questions, because we're here to always answer them.